The announcement comes from McKenzie-Willamette CEO David Butler, who was not a part of the panel of healthcare representatives and local leaders at the forum. According to Butler, plans for the emergency department began around January, a month after the PeaceHealth University District Hospital closed. While the emergency department, or ED, is not yet fully set in stone, Butler says they have done their due diligence and obtained a certification of need.
And we feel we found some locations that would be good access, and that, so we're in the process of developing a architectural plan.
This public reveal comes off the heels of community concerns regarding the closure of the PeaceHealth University District and having to go to Riverbend or McKenzie-Willamette in Springfield. Meanwhile, Dr. James McGovern with PeaceHealth assures that Riverbend serves the whole community, not just Springfield.
We did close University District Hospital. It was about a $24 million loss annually, and we only have so much money to invest. What we save from University District goes back into the community.
Among other issues tackled, the lack of primary care physicians.
In the last year, if you have lost your PCP, had to wait to find a PCP, or had to wait just to see your own PCP, raise your right hand.
The panel provided context toward the deficit of providers, with most of the panel agreeing it's a systemic issue and that they are aware. This was an issue Oregon Medical Group faced when Optum took over, losing more than 32 doctors in 2022.
We have to reimagine and re-engineer how we're delivering care. We have to bring more hands to the work, and you're scratching your head saying, well, where's the labor coming from? Because, everyone's read about the labor shortages in healthcare, so we have to fix that.
CAP also points out the systemic lack of physicians is part of the reason for the exodus of doctors in the community. A shortage of providers left some of them trying to serve more than 2,800 patients. One doctor who had 3,000 patients was Dr. Nick Jones. Jones was formerly part of OMG before leaving and starting his own practice. Jones believes that there is a conflict of interest when it comes to practicing medicine for profit.
Some of the healthcare reform that I would like to see is that physician organizations are owned by doctors. Instead, what we have is a bunch of legal loopholes where corporations effectively buy the doctors and own the doctors.
Wrapping up the forum, the panelists gave closing statements as well as announced future plans. Of note, McGovern announced expanding Riverbend Hospital and spoke about wanting to start a residency program. Short-term expansions from Riverbend can help tide over the community for long-term plans for McKenzie-Willamette. The specific location of the planned ED in Eugene is being kept under wraps as the land has not yet been purchased. The ED will be a satellite of the existing McKenzie-Willamette Hospital in Springfield. Reporting in Eugene, I'm Takur Conlu.
From the combined newsrooms in Eugene, Roseburg, and Coos Bay, KVAL News at 6 starts now.
A big announcement from the CEO of McKenzie-Willamette Hospital. A new emergency department is in the works for Eugene. Now, this comes in the wake of fallout that we've been covering closely following PeaceHealth's closure of the University District Hospital in Eugene more than 13 months ago. Good evening, I'm Kendall. Bartley. Brandon Cameraman is on assignment. Now, some relief is on the way as that news just broke that McKenzie-Willamette Hospital is in the process of building a new satellite emergency department in Eugene. KVAL's Takur Conlu has more.
Downtown district was probably seeing about 100 patients a day, so that influx has come to McKenzie and to Riverbend.
The CEO of McKenzie-Willamette Hospital, David Butler, making a surprise announcement Wednesday night at the citywide healthcare forum in Eugene, getting applause from the crowd. The public event included an 8-person panel with big names in the local health industry, including Chief Hospital Executive of PeaceHealth, Dr. James McGovern, and Executive Medical Director of Optum, Dr. Philip Kapp. Optum, now the owners of Oregon Medical Group, is embroiled in their own public controversy with the closure of their clinic not too far from the University District Hospital's former location. But the forum's main focus was overall lack of health care in the community, whether that be the lack of providers or the closure of healthcare facilities. Eugene residents in a previous interview made it clear they want care closer to home.
Before, people used to just walk here. Now they're going to have to take a taxi or something to get to the other place.
This was something that moderator Jensina Hawkins knew was going to be a hot topic ahead of the healthcare forum.
The lack of a hospital affects people who live on this side of the river. So when we think about any sort of a natural disaster or event that would remove the bridges or remove our access to Riverbend or McKenzie-Willamette Hospital, then we start having to think about if we have to drive west to go over to Florence to Peace Harbor Hospital.
Butler even acknowledges this issue in his announcement about the new emergency department in Eugene.
We have two really good hospitals in this community. Unfortunately, they're both in Springfield. And even though it doesn't take you an hour to get across town, it's a disadvantage to have to drive all the way over to, McKenzie or Riverbend to get health care.
He says McKenzie-Willamette has been in discussions for a satellite ED as early as January of this year, a month after PeaceHealth University District's closure. And Butler says they've done their due diligence in researching the community.
So we did some exploring and looked at the neighborhood. We looked at case studies. We got a developer involved who's local, who really understands the market here, and we feel we found some locations that would be good access, and that, so we're in the process of developing a architectural plan. Initially, our design would look at about a 15,000 square foot building. It'd be about 12 beds. We'd have CT, X-ray, ultrasound, all the basic needs.
But the plans to build it are moving full steam ahead. Meanwhile, McGovern sends out a message about the importance of preventative care when it comes to receiving health care in the community.
I will say, as a hospitalist and a hospital administrator, I do not want to see you at Riverbend. That's not where you belong. If you can get your care in the community and we can keep you healthy and out of the hospital, I am all for that.
Reporting in Eugene, I'm Takur Conlu.
Now, we did reach out to PeaceHealth for a direct response about the new ED, but did not hear back. The CEO of McKenzie-Willamette, David Butler, has announced plans to open an emergency department in Eugene. Now, this comes after concerns erupted following the closure of PeaceHealth's University District Hospital in December, something Eugene's Mayor Lucy Vinis has been vocal about. In 2023, prior to the closure, Vinis called on Governor Tina Kotek to deny the closure of PeaceHealth University District. She also listed the hospital among local health concerns in Eugene, saying it has deep implications for public health and emergency services. Though it will take some time for the new emergency department to be built, Vinis says this could be a solution.
That is part of our goal, is that the larger metropolitan area is fully served. And so we are concerned about people on being on the wrong side of the river from the two hospitals, for sure. I am deeply appreciative of McKenzie-Willamette Hospital for considering this and for stepping forward with what could be a really terrific solution.
Now, according to Butler, McKenzie-Willamette has been working with the city and has obtained investors and necessary permits, including a certificate of need. Vinis says the conversations with the city have been going on since the spring, saying McKenzie-Willamette did their first step of due diligence before reaching out to the mayor and city manager.